Hello and welcome to Heart Attack Awareness. Imagine a silent alarm ringing, not with a blaring siren, but with subtle whispers from your own body. These whispers are your heart's urgent plea for help, often disguised as minor discomforts. Ignoring them can have devastating consequences, yet recognizing them can be the difference between life and death. This isn't just about symptoms, it's about understanding your body's critical signals and acting decisively. A heart attack, medically known as a myocardial infarction, occurs when blood flow to a part of the heart is blocked. This blockage, usually a blood clot, starves the heart muscle of vital oxygen. Without oxygen, heart muscle begins to die, leading to permanent damage. The urgency cannot be overstated. Time is muscle. Every minute that passes without treatment increases the damage to your heart. This is why recognizing the warning signs immediately is paramount for survival and recovery. It's not just about saving a life, it's about preserving the quality of that life. Heart attacks don't always announce themselves with dramatic, Hollywood-style chest clutching. Often, they begin slowly, with mild pain or discomfort that can be easily dismissed. This deceptive nature is precisely why public awareness is so critical. We must learn to differentiate between a minor ache and a potentially life-threatening signal. Many people delay seeking help because they don't realize what's happening. They might attribute symptoms to indigestion, stress, or muscle strain. This delay is dangerous, as early medical intervention significantly improves outcomes. Your awareness is your first line of defense. Chest discomfort is the hallmark symptom of a heart attack, affecting most individuals. It's crucial to understand that discomfort can manifest in many ways, not just sharp pain. This symptom often presents as an uncomfortable pressure, squeezing, fullness, or a dull ache. People frequently describe it as an elephant sitting on my chest or a tight band around their chest. This sensation can last for more than a few minutes, or it might go away and then return. It's not always constant, which can be misleading. The discomfort is typically located in the center or left side of the chest. It might feel heavy, constricting, or like a burning sensation. Do not dismiss this as mere heartburn, especially if it's accompanied by other symptoms. Any persistent or recurring chest discomfort warrants immediate attention. Heart attack pain isn't always confined to the chest, it can radiate to other parts of the upper body. This referred pain can be particularly confusing, as it might seem unrelated to the heart. Understanding these potential locations is vital for accurate self-assessment. Pain or discomfort can occur in one or both arms, often the left arm, but it can affect both. It might feel like an ache, numbness, or tingling sensation. This arm pain can be a primary symptom, even without significant chest discomfort. The back, neck, jaw, or stomach are also common sites for referred pain. Jaw pain, especially in the lower jaw, can be a subtle but critical sign. Back pain, particularly between the shoulder blades, can also indicate a heart attack. Stomach discomfort might be mistaken for indigestion or a stomach ache. Shortness of breath, or dyspnea, is another significant warning sign that should never be ignored. This can occur with or without accompanying chest discomfort. It might feel like you can't get enough air, or you're gasping for breath. This symptom can be particularly alarming and often prompts people to seek help. It's the body's way of signaling that something is severely wrong with its oxygen supply. The heart, struggling to pump blood effectively, can lead to fluid buildup in the lungs, causing breathlessness. If you suddenly find yourself struggling to breathe, especially if it's unusual for you or occurs during rest, consider it an emergency. This isn't just about feeling winded after exertion, it's about an unexpected and often profound difficulty in breathing. It can also manifest as a tightening sensation in the chest, making breathing feel restricted. Breaking out in a cold sweat is a less commonly discussed but equally important warning sign. This isn't just feeling a bit warm, it's a sudden, clammy perspiration that occurs regardless of the ambient temperature. You might feel cold and damp, even if the room is warm. This physiological response is often due to the body's fight or flight mechanism kicking in. The heart, under immense stress, triggers the sympathetic nervous system, leading to sweating. It's a sign of significant internal distress. If you suddenly experience a cold sweat, especially when combined with other symptoms, do not dismiss it. It's your body's urgent signal that something serious is happening internally. This symptom often accompanies nausea or lightheadedness, amplifying the sense of unease. Heart attacks can present with a range of other symptoms that are often less specific but equally critical. These can include nausea, lightheadedness, vomiting, indigestion, or feeling unusually tired or weak. These symptoms can be particularly confusing because they mimic common, less serious ailments. Nausea and vomiting are common, especially in women, and can be mistaken for a stomach bug or food poisoning. Lightheadedness or dizziness, sometimes leading to fainting, indicates a drop in blood pressure or insufficient blood flow to the brain. Feeling unusually tired or weak, especially without exertion, can be a subtle but persistent sign. Indigestion, often described as a burning sensation in the upper abdomen, can be particularly misleading. Many people take antacids, delaying critical care. If these symptoms are new, severe, or accompanied by other warning signs, they demand immediate medical evaluation. Never assume it's just indigestion when your heart could be at risk. It's imperative to understand that heart attack symptoms can vary significantly between men and women. This gender difference is a crucial area of public awareness and medical education. Women are often more likely to experience atypical symptoms, which can lead to delayed diagnosis and treatment. While chest pain is still the most common symptom for women, it may not be as severe or as central as in men. Instead, women are more likely to experience shortness of breath, nausea/vomiting, and back or jaw pain. They might also report extreme fatigue, dizziness, or lightheadedness. These less classic symptoms can be easily dismissed by both women themselves and sometimes by healthcare providers. Women might attribute them to stress, anxiety, or other conditions, delaying seeking emergency care. This delay can have serious consequences, as early intervention is key for both sexes. The reasons for these gender differences are complex, involving physiological, hormonal, and even societal factors. Women's heart disease often affects smaller blood vessels, leading to more diffuse pain. Hormonal differences also play a role in how symptoms manifest. Furthermore, women are sometimes less likely to report symptoms or may downplay their severity. This can be due to a variety of reasons, including a tendency to prioritize others' needs or a lack of awareness about female-specific heart attack signs. Educating everyone about these differences is vital. It's crucial for women to be acutely aware of these variations and to advocate for themselves if they suspect a heart attack. Healthcare providers also need to be vigilant in recognizing these diverse presentations. A heart attack in a woman might look and feel very different from what is typically portrayed. While recognizing symptoms is critical, understanding risk factors and prevention is equally important for long-term heart health. High blood pressure, high cholesterol, diabetes, smoking, obesity, and a family history of heart disease all increase your risk. Managing these factors proactively can significantly reduce your chances of experiencing a heart attack. Regular medical checkups, a balanced diet, consistent physical activity, and stress management are cornerstones of prevention. Don't wait for symptoms to appear, take control of your heart health today. Prevention is always better than cure, and informed choices can lead to a healthier, longer life. If you or someone you know experiences any of these warning signs, the single most important action is to call 911 immediately. Do not try to drive yourself to the hospital. Do not wait to see if the symptoms improve. Every second counts when it comes to a heart attack. Emergency medical services, EMS, personnel are trained to recognize and begin treating a heart attack on the way to the hospital. They can administer life-saving interventions, such as oxygen and aspirin, and prepare the hospital for your arrival. This pre-hospital care can significantly reduce heart damage and improve survival rates. Do not let embarrassment or denial prevent you from seeking immediate help. Your life is far too valuable. If you are unsure, err on the side of caution and call for help. It's always better to be safe than sorry when your heart is on the line. When you call 911, be prepared to describe your symptoms clearly and calmly. The dispatcher will guide you through what to do until help arrives. They can also provide instructions on administering aspirin, if appropriate, which can help thin the blood and reduce clot formation. Once EMS arrives, they will assess your condition, perform an electrocardiogram, ECG, to check your heart's electrical activity, and begin treatment. They will transport you to the nearest appropriate hospital, often bypassing the emergency room to go directly to a cardiac catheterization lab if needed. This streamlined process is designed to save precious time and heart muscle. Understanding heart attack warning signs is not just about personal safety, it's about empowering your community. Share this vital information with your family, friends and colleagues. The more people who are aware, the more lives can be saved. Be an advocate for heart health. Remember, a heart attack is a medical emergency. Your quick thinking and decisive action can make all the difference. Don't hesitate, don't delay, and don't ignore the whispers from your heart. Listen to your body, trust your instincts, and act immediately. Your heart is a vital organ, and its health is paramount. Don't wait for a crisis to become informed. Take control of your heart health today. Here's what you can do. Share this information, educate your loved ones about these critical warning signs. Know your risk factors, schedule a checkup with your doctor to assess your heart health. Learn CPR. Knowing CPR can be life-saving for someone experiencing a cardiac emergency. Commit to a heart-healthy lifestyle, make conscious choices about diet, exercise, and stress management. If you or someone you know experiences any of these symptoms, even if you're unsure, do not hesitate. Call 911 immediately. Your swift action could save a life, perhaps even your own.